To make a model of the brachial plexus, I am starting with 5 pairs of pipe cleaner. You'll notice that I labeled C5, C6, C7, C8, and T1. I also would tell you to actually pay attention to where superior is and where inferior is, because that will help you understand where the trunks are going to be. Now, to get the trunks, I am going to wrap C5 and C6 together and C8 and T1 together. Remember that the middle trunk, or truncus medius, is made up of only C7. And so I will twist this and show you in a little bit. Now, what I did in this one is, if you notice, on the top part where you have the superior trunk, or truncus superioris, I wrapped around C5 and C6. C7 makes the truncus medius, or medial trunk, middle trunk, and the inferior trunk, or truncus inferioris, is made up of the roots C8 and T1. Now there are variations to this, and this is meant to be a basic one, so you could actually see how the pretty much the basic brachial plexus. You can add more roots if you are so inclined. Now once you have your 3 trunks, you can form the divisions. I wanted to show how you have posterior divisions in the back here and anterior in front. And so I did label it there, but I'm really using that label more for the posterior cord when we get to it. Again, you can see how all 3 of them have divisions. Some of them are going to the anterior portion, some are going to the posterior. And I will actually work with the posterior cord first, and then 2 main nerves that are coming off the posterior. There are a lot more nerves than what I'm talking about, and depending on how much you want to go into different nerves, you can actually run around the end of the roots here and put a long thoracic, or you can actually do the pectoral. You could do any of the nerves that you want, but this will actually give you a basic structure. Now, over here I put a pin so you could see that there is an anterior, 2 divisions here going anterior, but all the posterior divisions go to the posterior cord, which you can see here. This will go to the back of the arm. Now, as these 2 are going to the front of the arm, we can't say it's anterior and give them both. So what we end up doing is we end up looking at where they go in the arm. And so on this side here, you will have the lateral cord, and over here, the medial cord. And I will show you the label in a little bit. As we continue making our model, I wanted to show you how you have the anterior areas here, the posterior cord here. And so you have the medial cord, the lateral cord over here, medial cord over here. And as you come over here, I did already divide the nerves. Now I'm using just green for the, which would technically be on the C8, if you actually were to follow it back. But in reality, if you look at the cords, you have to pay attention that when you get to the trunks, it's not necessarily going to go exactly into one nerve. But I did want to make sure that you saw that the radial nerve has more roots. In fact, radial uses a posterior for C5 all the way to T1. And all you have to do is follow it back. I put a pin there so you could see how you have the anterior and posterior. And now I'm going to actually separate the lateral and medial cords to give you the different nerves. So over here, what I ended up doing is I twisted branches from the medial cord and the lateral cord over here to form the median nerve here, which I'll explain it later. You also have the musculocutaneous coming up here, musculo for muscle, cutaneous for skin. And over on the inferior side, you will have the ulnar nerve coming out. Now, one thing to remember is these 3 nerves, the ulnar, the median, and the radial, will all be found in the forearm. And the easy way to remember it is if you take this and you put your arm in anatomical position, you can see that the radial nerve is going to follow the radius, the ulnar nerve will follow the ulna, and the median nerve will be between them. Again, median nerve, just like the radial, has innervations from C5 all the way to T1. And the nice thing about this is you can see where it's at. You can even put this on your arm so you can see where the nerve would run with the bones. I hope you enjoy this and have a nice day.